हेलो अस्सलाम वालेकुम।
वालेकुम अस्सलाम सर। मैंने सबको म्यूट किया हुआ है तो।
बस ठीक है, मैं सिर्फ अपना देख रहा था, मेरी इसमें स्लाइड आ गई है
जी सर, आपकी स्लाइड शो हो रही है।
और मेरी आवाज़ ठीक है।
आवाज़ बिल्कुल ठीक है सर।
बस ठीक। आज कितने एक्सपेक्टेड स्टूडेंट्स हैं?
सर एक्सपेक्टेड तो 70 है।
ठीक है। और आज है भी जुमा, मेरा ख्याल है ज़रा कोशिश तो थोड़ी सी जल्दी करनी पड़ेगी क्योंकि 1.5 घंटा है, उससे भी पहले शायद, क्योंकि लोगों को जुमा के लिए जाना होता है, मुझे ये पता चला है कि
जी सर।
वो दे आर इन हरी।
जी सर।
बहरहाल चलो कर लेंगे, 1 घंटे में इंशाल्लाह कर लेंगे।
जी सर, इंशाल्लाह
तो अल्लाह
सर।
खैर करेगा। तो अभी कुछ ज्वाइन किए हुए हैं
अभी
स्टूडेंट्स?
13 पार्टिसिपेंट हो गए हैं इंशाल्लाह। 5 मिनट तक इंशाल्लाह स्टार्ट कर देते हैं सर।
हाँ ठीक है, हम फाइन। हाँ मतलब कोई 25-30 तो हो जाए ना, ताकि वो
हाँ जी।
थोड़ा सा।
और
ठीक है, आई
सर,
एम ऑनलाइन, नो।
और जब ये सेशन सर खत्म होगा तो फिर इसी लिंक को ही रीज्वाइन कर लेंगे सभी।
अच्छा, ये 1 घंटे का होता है?
ये सर 40 मिनट का होता है।
ओए अच्छा, 40 मिनट
उसके बाद फिर
का।
दोबारा से रीज्वाइन किया जाता है।
अच्छा, 40 मिनट के बाद दोबारा हम इसी लिंक को रिज्वाइन करेंगे?
जी सर।
उसमें आधे स्टूडेंट्स वैसे ही भाग जाते हैं। मेरा ख्याल है पहले 40 मिनट में जो करना है कर ले। मेरा एक्सपीरियंस तो यही है, लास्ट टाइम भी यही हुआ था। दोबारा वो जब रीज्वाइन किया तो बंदा ही कोई नहीं नजर आया, थोड़े बहुत ही थे। बहरहाल अल्लाह खैर करेगा, नो प्रॉब्लम।
इंशाल्लाह।
और आप खैरियत से हैं?
अल्हम्दुलिल्लाह सर।
मुलाकात ही नहीं हुई आप लोगों से, अब आना ही नहीं हुआ। वो आएंगे इंशाल्लाह किसी दिन।
इंशाल्लाह सर।
ये ये ऑनलाइन के चक्कर में मुलाकातें ही बंद हो गई हैं। ना किसी को पहचानते हैं ना कुछ। ना किसी हम स्टूडेंट को जानते हैं, अब ना हमें वो जानते हैं। मतलब शक्ल ही देखी होगी उन्होंने हमारी, पता नहीं शक्ल भी इस पे नजर कैसी आती है।
जी।
तो बहरहाल ये टेक्नोलॉजी का एक ये हिस्सा भी है। मैं मतलब घर में बैठे आप लेक्चर दे रहे हैं, ये भी था।
जी।
बहरहाल दिस इज द वे हाउ लाइफ इज। और
वालेकुम
आप लोग
सर।
खैरियत से हैं? अस्सलाम वालेकुम जी, क्या हाल है डॉक्टर साहिबा?
अल्लाह का शुक्र है सर। थैंक यू सो मच सर आपका हमारे
नो
साथ आने
वरीज,
का।
नो नो वरीज, नो वरीज। ये मुझे ये और बता रहे थे कि ये 40 मिनट्स के बाद रीज्वाइन करना पड़ेगा।
जी सर, ये जूम का है
ठीक है।
सर।
हाँ आई नो आई नो। वो पिछली दफा भी ऐसे ही हुआ था, तो जब रीज्वाइन किया तो स्टूडेंट ही कोई नहीं वापस आया।
फौरन ज्वाइन कर लीजिएगा इसी लिंक को।
इंशाल्लाह इंशाल्लाह आई ट्राई, बट आई ट्राई टू डू द मेजर पार्ट इन दीज 40 मिनट्स, क्योंकि आज जुमा भी है तो वो मेरा ख्याल है लोगों में
जी
प्रेशर भी होता है।
जी जी।
तो बाकी चीजें कल कवर कर लेंगे जो रह जाएंगे इंशाल्लाह। खैर आज तो एक ही पार्ट करूंगा, 2 पार्ट कल है। तो कल
जी
भी
सर।
यही टाइमिंग्स है?
सर नहीं, कल 12 से 2 है।
बस फिर ठीक है, उसमें फ्लेक्सिबिलिटी है ज्यादा।
जी जी।
चले जबरदस्त। और आप लोग खैरियत से हैं?
अल्लाह का शुक्र है सर।
चले अल्हम्दुलिल्लाह। बस ये जैसे ही मेरे ख्याल 25-30 लोग होते हैं तो वी स्टार्ट इंशाल्लाह।
जी सर, विद इन 5 मिनट्स आप कर दीजिए सर।
ठीक है, नो प्रॉब्लम, आई एम जस्ट वेटिंग।
जी।
अस्सलाम वालेकुम सर। 33 पार्टिसिपेंट हो
जी।
चुके हैं। काइंडली आप स्टार्ट कर दीजिए।
चले मैं कर लेता हूँ। थैंक यू वेरी
थैंक
मच।
यू सर।
ओके
करते हैं।
जी। Assalamu alaikum wa rahmatullahi wa barakatuh to all the participants and guests. My name is Dr. Amir Johri. I think most of you now must be knowing me, those who are coming from the first batch. I'm a public health physician with my own experience in World Health Organization and other ministries of health, and even in Pakistan. Now I've been given this chance to present the this course here in Lahore with IPH. I'm thankful to the IPH management for giving me this opportunity, which is, I was once, still I'm part of IPH, but I was a regular employee at IPH at my young ages. Anyway, to start with today, the topic that I'm going to cover is a big one. I've been given a topic. It is governance, ethics, and accountability in public health institutions or health institutions. But today, what I will do is, because the time is short because of the Friday, what I'll try to do is I will concentrate on governance and public health institution, try to browse you through the most of the important parts. Maybe many of you may have much more experience than me in management somewhere, but I will just give you a generic viewpoint about governance at the international level as well as at the national level and the provincial and then down at the grassroots level. So if we look at governance, people start talking about what is governance, what you govern, how you do. So basically, if we see the word comes govern, that you govern something, to govern, to own something, to do something with a system. You need power, you need uh, resources, you need accountability, you need application of your knowledge, you need networking, and so many other things would come in. So this we will put it together as one of the definitions which have been identified by World Health Organization, and I will browse through that. Uh, through that definition now. Okay, now if you see there, what WHO says, the health system governance is the processes, the structures, the buildings, institutions, the one where we are talking today from where we are, and looking at and kind of managing the country's healthcare system. So again, what I've already mentioned is the relationships. You know, always the relationships in any management system is very, very important. Who are the actors? Who are the players? Now, here, if you see the actors would be the providers, you, me, and others, the doctors, the administrators, the hospital staff, whether paramedical, medical, nurses, so on, the patient themselves, and even their families are part of it and the community. Civil organization have a role to play, and then we have private entities now where we have public private partnership entities in the system. Let me tell you one thing. In my presentation, there would be something very generic, maybe because as the health system or the health department is reorganizing itself. So there are few changes. So you must see that what is, because it's happening every day. Something new is coming. I'm from the old school, but still, like, I have tried to educate myself to today that what best I can provide. So looking into that, if you see uh, the health system, basically, why we want these system to be governed properly, give equity. You understand equity. Equity is the giving everybody the same type of healthcare, whether disabled person, whether unprivileged or a rich person or so. They all get the best treatment at our hospital. It should be efficient that, once they come into the hospital, we give them promptly their need. We give them the treatment they require. And last but not the least, the quality care is very important because you need to satisfy patient, the one who comes in. You need to satisfy the family. You need to satisfy people around them. So there is a doctor or nurses or paramedical or other people at the hospital. The role is very complicated. It is not just one patient and one person. He or she walks in, you give medicine, you give treatment, and they walk away. No, there are a lot of things added to that, that how you behave, how they behave, how things are moving on, how is the treatment going on. Science is there, but then you have your art of doing work at the hospital. So in those cases, if you see, all this could not be possible, especially both, even in the private and the public sector, that if there are no allocation of resources. If you don't have resources, you don't have regulations, you don't have people working for you, you don't have doctors, nurses, paramedical staff in the hospital, how can you provide best management or best care? Once you have all these, then you need to be monitored, right? Monitoring is important because you evaluate yourself, that are you doing the right things or are you doing things in the right way? And then that will lead to the what you call it, social justice, we call it, that what we do for the community in totality, as in the hospital, as a healthcare provider. So here, what I'm trying to say is that in governance, you have all these chunks available with you, but how you play with it, how you use your acumen, your knowledge of health management, community integration, and talking to yeah, your interpersonal skills, that how you convene, how you convince your patient to do so and so. So in totality, governance is all about. And that's why people say the governance is not good, the governance is bad. So they have a lot of things which will be coming in as a part of governance that I will take you to the next slide about it. The foundations. Every time we do things, we have foundations or we build something over it. So what I try to do here is we put the foundation of governance. This is based on WHO principles of public health. And to start with, I will have the first one, which is rule of law. That is very important because the policies need to be there. We should be allocated budget, and we should apply those budgets in a very legal way, and we must have a legal framework where we stay in that. With, if we have to advertise, we have to advertise. If there is amount that we cannot advertise, we can do it at local purchase, we do that. And then licensing by PHC, Punjab Healthcare Commission, and the procurement rules of Punjab government, and so on. So there are standards and regulations inbuilt there. And if we follow them properly, I think we are doing the first part. That is the foundation, the first foundation of doing the governance, because that will be the first steps to move forward. Secondly, is the involvement and participation. So if you see involvement and participation, it's very easy to say, like for presentation's sake, fine. But point is, how many times people from the community come and sit with the administrators, the managers, how the hospital is doing? Maybe at the tehsil level, maybe at the district level, or maybe at the union council level, they are doing it, but not at the tertiary care. This is what I see. But if there is anything going on, I think that will be a good thing to do. So if you see here, the community members, the patients, and they all have a role to play in designing and engaging our consultation. Because in the beginning, as I said, it is in totality, it is everybody is involved. It is not only the health department. There are other departments also providing health, like not only healthcare, but they are like, for example, you would say that, okay, which other department is helping us? WASA, Water and Sanitation Agency. If they don't provide safe water, people will get sick. They will have diarrhea, they will have other diseases. So if they provide best quality of water, which is safe to drink, definitely the incidence of diarrhea would be less, and there would be less burden on healthcare facilities. So, and then we talk about smog. Means I'm talking about one of the environmental part. When there is smog, there is rise in acute respiratory illnesses. And if the environment is clear, you don't get people with coughing, sneezing, and all that. So that is where this involvement and participation comes in. Third is transparency. Well, it's jargon, but I think this is where it saves you skin. Transparency is something really important that once, whatever you have, whatever the budget you get, whatever procurement you do, it is done in a transparent way that people know that these were the steps taken, one, two, three, that it was advertised, that there were firms coming in, they were scrutinized, and then they were given the project or they were given that tender. In that, you have to see their background, you have to see their reports, evaluations, and other things, which are really important for the administrator and managers to understand. Because once you do things in a very transparent ways, in the end, but in the end, you will be on a very safe side. It's a difficult part. It is not done everywhere in the world, but it is an important foundation of governance. Fourthly, is the responsiveness. Why I say responsiveness is that the institutions are responsible to the communities. What we are trying to do, we are trying to give community services. We are trying to treat people around us, those who come to our hospitals, come to our healthcare facilities, we try to help them to ensure to give them the best quality of service. So our response should be excellent. It should be ethical, it should be quick, it should be efficient, to the point, and respectful. Fifth, equity inclusion. As already in the definition, when we did talk about equity, equity is that all people get the same quality of care, right? So equity inclusion is very important as the fifth foundation of the governance because it should not matter anybody walking into the hospital if he is rich or poor or disabled or comes from a different background, you don't give them the proper treatment or proper, uh, you don't take care of them in a way they should be taken care of. So, equity is another a very important foundation pillar in public health practice. And lastly, the effectiveness. Because, okay, we do all these things, but in the end of the day, we are not doing anything in an effective way. Our effectiveness is not there. The 20 people are coming in and none of them is getting better or they are not satisfied. That means we are not producing the optimum results. We are not using the optimum resources. We need to be more accountable. We need to have more effectiveness that will come with the resource allocation and also the accountability. The accountability, we will be talking about that tomorrow in more details, but effectiveness has a part where it can become very effective if you use all these pillars. And in the end of the day, you will see that all your processes were effective and you can measure it by accountability, by monitoring system, by evaluating system that where we were and where what we did. Moving on, there are several governance models that are being used globally, and they are also used here in Pakistan and especially in Punjab. So the way I have done that, I put it in three ones and tried to tag them with the Punjab uh, government models. bear with me if you think that this is not the way. We can always discuss that. But from my side, whatever I can gather all the information, because I again said in the beginning that as the health department in the government of Punjab is going through the transformation, so that's why we need to live with that. As I was told the other day that they have moved the preventive side of the Director General's office into five PDs, and somebody is taking care of communicable disease, somebody is taking DHIS too, and somebody is doing his do and things like that. So it is already there, but what I'm going to talk is in a very generic way. So if you see the first part, which is called hierarchical way, that there is a hierarchy, and have put the strengths and the weaknesses and thus given an example to that. In this model, which we have lived with, there is clear lines of duty. There is a minister, there is a secretary, there is a director general, then there are the DHOs and directors and DHOs and so on. This is the old model. When I was here, I used to work in that model. And on the curative side, then you have the secretary, minister, the secretary, and the emissaries or the board of governors and all that. Looking at that, there is clear lines of authority. Whatever is the decision is taken at the minister and secretary level, it is conveyed down or trickles down. The other strength is that there is a consistency in policy application, because one person has taken the decision and then others are taking it forward. So there is the same person is there and he or she would support that. So that's why there is consistency and they will stick to that policy that they have made. And thirdly, the efficient top down direction, as I've already mentioned, that what comes from the top, it goes down. Once it trickles down, people see that and they implement it at the level of the managers, right? There are few limitations. For example, it is very centralized. It is not easily adaptable because, if you say, okay, whatever comes from the top, in my hospital, I have other problems. So where should I go? But there is no other place where to go. So you go back there and they say, oh, this is the policy, you do it. Thank you very much. So in that, what I see is the initiative of the staff is less. Reason being that if I'm just having one hospital, I'm the medical superintendent or I'm one of the CEOs of the district. I'm trying to do something new, but they say, no, the policy is this. You cannot move out of this. So I said, okay, whatever comes in, it goes out. There is no very intelligent initiatives coming from my side. So, in that, if you see, I've given the example of Punjab Health Department as it used to be in the previous years. Now those things have changed. And if you see the second part, which is called the networking, where you have more, broader base, in which the example would be now as we have divided the health department into two. One is the health and population department, and second is the secondary health and medical education department. They have two different ministers, they have two different secretaries, and then they have their own paraphernalia. In that, the strengths, let's look at the strengths. Strengths are it is flexible, adaptive. You can you can reach the top easily. You can talk to them, you can convince them, and knowledge can be shared across whatever you say. Maybe it is heard at the top, and it can lead to better community integration because you are more people and you are more concentrated on the one is the preventive side, and the second part is on the curative side. So your line of action is very clear. So that's why you can integrate your work with the community easily. But there are certain limitations here. Uh, Once you have one department, now you have two, you have more staff to work with, the cost would go up. Sometimes they say the accountability is not clear. Like, for example, a CEO or the medical superintendent of a hospital is he responsible to which department? It is clearly written that the public health or the preventive goes to the HNPD, and SH and MED is the hospital side. But still, there may be some confusion which can lead to very unclear accountability. And then variable quality across nodes. Yes, why I say variable quality, because if you have one person running a hospital is doing the best work, and the other hospital person is not full of initiative, so there would be a discrepancy. The other one part, the one who is very active is doing better, and the outcome is much better than the other. So there is up and down. You don't see all the hospital doing the same way, because now there is initiative coming in. They have more power, they have more staff, and they're doing it. So this is the second model. And the third one I put here is the participatory, which is the grassroots model. It is now what the way I see is it is at the community level with these different districts, tehsils, where we have our CEOs in our health authorities. Then you have district health officers, and then you have assistant district health officers and other staff members. The strength of this part is that it is owned by the community and it has a very strong public trust. People think that you are sitting among us, and in being with us, we can talk to you that this is the right thing you're doing and this is not right, and which we cannot kind of agree with that. So there is a way to interact with the community and make the best thing available to them. Because the important point here is that the local relevant decisions are important for the administrators, because in the end of the day what we are trying to do here is to get to give best services to the community, right? Now if you see the limitations, it is important because these kind of participatory approaches, they are very time consuming. Why I say that? Because everybody has a different mindset. Community would say that this is what we say, uh, this should be done or those steps, this is what you should put more money into, you put more doctors here and there. But based on your knowledge of the health department as a scientist, you see the trends. You just tell them that, yes, we are here to help you, but we see the trend of this disease and this area and this thing and this environmental concern. So that is kind of very important to convince them. And that once you have discussion and participation among different groups, that will take time. Then I put another thing, the risk of lead capture. And why I say that risk of elite capture, because they can, those who are very influential at the local level can influence very easily on the care system. And last one is it's difficult to scale quickly because you don't have much funds as you have on the other parts or other governance models. So to do something quickly would not that be easy. So in that, I have given an example of Community Health Council, DHQ level, and there are uh, district health authorities where CEOs are the in charge. So this is basically I'm trying to give you a passing through different approaches which are used around the world, and even it fits in Pakistan as well. Moving on, now we have different roles. Everybody has a different role to play, trying to understand the hierarchies, that who is doing what and who is supposed to do what. In that, everybody has a different role. So what I've done here is I put them in layers. If you see the first layer, The first layer are the regulatory bodies, right? The regulatory bodies are, some may not be directly responsible here, but I just put it as an overall thing. In Punjab, it is the Punjab Health Department, definitely. Then we have Punjab Healthcare Commission. At the national level, we have our National Health Services Regulation and Coordination Ministry. Why I put Auditor General and National Accountability Bureau and parliamentary health committees, because sometimes we are answerable to them. And that will come into this accountability presentation, that why they are important. But I thought that in this presentation, I would say that these are the regulatory bodies which are on the first tier. Second is the governing boards or the hospital management committees. So they also have a very important role to play with. If you see them, and this they whatever comes from the regulatory bodies, the policies are made. Now at this, what they do is they give the strategic oversight, that how to do these things, how to implement this policy. They approve the policies, they put on the finances, they look at the risk, they look at how to do it, what are the ethical ways of doing it. This is all done at the government or governing board of the institution, or the hospital management committee at the top. And thirdly, if you see, is the executive management, where most of my colleagues, who you are attending this course, comes in, like medical superintendent, as CEOs, COs, medical directors, nursing directors, departmental heads, and so on. So the reason I'm putting this slide is just to see where the role of people are. Regulatory bodies at the top, that they make regulations, they make all that. Then it trickles down to the governing board and the hospital management committee. Then they have this policy with them. And with the policy, now they decide that how to move that policy, how to get the best results out of that, how to manage it, how to govern it. And then the last part is the executive management. There, at the executive management level, action is there, where you people come in. You have to implement, you have to look at, and you keep in your mind all these two tiers: the regulatory bodies, the governing hospital management committees, and you yourself as an executive member of the management at the hospital or at the district level. So you have a very important role to play with, right? So again, this will we will talk about this one in more details tomorrow, inshallah. But what I have put very quickly here, if you see, that accountability reporting lines. Accountability reporting lines are important. For example, there is a board which is responsible to the government, and government is the regulatory body. Here, they will see the annual performance, they will do the budget allocation, they will do the audits and inspections, and so on. So this is between the government is at the top, then comes the board. From the board, it comes to the management. So the management now, if you see here, now the management is reporting to the board, right? This is the management reporting to the board. So now they are making key performance indicators, reporting, financial statements, and so on. Thirdly, if you go, now the staff is responsible to the management, where they do their performance appraisal, they provide SOPs, standard operating procedures for the compliance, patient outcome data, incoming data, whatever is reported, it goes there. And then comes in the Punjab Healthcare Commission. It is also looking at all the tiers of the management, where what is happening. Are they looking at the inspection? They're looking at the licensing compliance, whether the license has been given to that hospital. Are they abiding with that? How the public is working with them. The scorecard means that what public responds, what they think about it, enforcement of actions, and so on. Coming next is public financial management and procurement ethics. I may not be the best expert on this, but I will just walk through it. Maybe you must have much more experience in that. Maybe somewhere my information may be outdated, but just to give you a flavor, I will just quickly pass through this slide just to give you the information that first is the budget planning and release, that you need to have a budget. You need to plan for it, and it should be. It's not that you have a budget of 2 crore rupees, for example, and it is not released. It is released after 5 or 6 months. Those must be the problems here. I know, and we have been facing that. So that is very important. We do that. Secondly, procurement rules now are there. This public regulatory authority, procurement public regulatory authority, is now overseeing all procurement rules or all procurements in the Punjab government. And thirdly, there are internal financial controls of the department where they do starting from the teaching hospital down to the district hospital, Tahsil hospitals, and then down. Now it has been gone to the public-private partnership. I really am not very much aware how they are going to do the financial control at that level. It is still coming up. So I think I was in one of the districts doing one of the project last 6 months on international health regulations, and I met several CEOs of the districts, and they were not very clear because they said that our rural health centers and basic health units are not reporting to them, and they are not getting any uh, feedback, even not getting any data about the disease, which was the source of the primary data. So these kind of things are still coming in, and we need to build on that to make it much better. And lastly, if you see the external audit, which is done by the Auditor General of Pakistan, then you have to report to the Parliament and Public Account Committee and so on. So just to give you a flavor, but maybe you are more, uh, knowledgeable on this part, those who are doing these things every day. But my point was just to give you an idea that